I'm Dr. Raman Puri, Chairman of the Lipid Association of India. Lipid Association of India has been doing scientific work in lipidology since 2012. We have published several scientific papers, both in national and international journals, about how we should treat Indians and South Asians with lipid disorders and what should be the LDL cholesterol goals in different ASCVD risk categories, based upon the presence of risk factors and other high-risk conditions. Higher the risk, lower are the LDL cholesterol goals. Now let's talk about blood LDL cholesterol and CV events today. When I say CV events, it means either heart attack or stroke or death. This is important because of some misconceptions in media about high blood cholesterol and CV rates. There are some videos in circulation that suggest that high cholesterol is not bad for the body. One of the assumptions is that since cholesterol is produced mainly in the body, what is made in body can be harmful. There is no doubt that cholesterol plays a vital role in the body, including cell membrane formation and in the synthesis of essential hormones like testosterone, estrogen, cortisol, and aldosterone. Now I will share some facts with you about coronary artery disease in India. Indians have a 3 to 4 times higher incidence of heart attacks as compared to Americans. They have coronary artery disease 10 years earlier than other ethnic groups. 25% of Indians who suffer from heart attacks are less than 40 years of age. And 50% of deaths due to coronary artery disease, which means heart attack, are in those who are less than 50 years of age, in contrast to European, in which more than 90% of deaths due to coronary artery disease occur after 65 years of age. There has been a 50% decline in mortality associated with heart attacks and stroke in the Western countries. In contrast, it increased by 41% in India between 1990 and 2015. Several factors contribute to this increase, including central obesity, dietary habits, physical inactivity, early onset of diabetes, smoking, tobacco chewing, hypertension, and also poor public awareness about prevention of coronary artery disease. But abnormal lipid levels are one of the most important factors. Indians have a special type of lipid profile. They have high triglyceride, HDL, which is also known as a good cholesterol, is low. LDL cholesterol is either normal or mildly increased. LDL particles numbers are increased. These LDL particle carries 80% of the circulating cholesterol. And also these small dense LDL particles are highly atherogenic and can easily deposit in arteries and initiate the process of atherosclerosis. This may explain why CAD develops early and aggressively in India. Knowing a few facts about LDL cholesterol is essential. LDL cholesterol is also known as bad cholesterol. There is a strong relationship between LDL cholesterol level and the incidence of heart attack and stroke. The higher the LDL cholesterol value, the higher are cardiovascular events. Rarely, genetic mutations leads to extremely high LDL cholesterol levels since birth, as seen in homozygous familial hypercholesterolemia. If undetected early in life, many children with this disease will suffer from anginal episodes, that means chest pain on exertion, and maybe a potential candidate for CABG or angioplasty by the age of 10 years, if left untreated. Majority will die from extensive cerebrovascular disease, which means either heart attack or stroke, by 20 years of age. In contrast, there are some mutations which leads to low LDL cholesterol levels since birth, and these individuals have lower incidence of cardiovascular event at later part of their life. And in one of such mutation, LDL cholesterol can be as low as 14 to 15 mg per deciliter since birth. The individual in this group are healthy and fertile. You will be surprised that when we are born, our LDL cholesterol is very low, in the range of 20 to 50 mg per deciliter. And in these low LDL cholesterol level, all our organs are fully developed and functioning. Many factors contribute to its increase later in life, including dietary habits and physical inactivity. It is important to know that every organ, including adrenal glands, can produce cholesterol as per their requirements. If additional cholesterol is still required, then LDL cholesterol in the range of 25 to 50 mg in circulation will be sufficient to fulfill their need for extra cholesterol. The brain does not need cholesterol from the circulation at all. It makes adequate cholesterol in its own compartment. Now let me tell you about some benefits of LDL cholesterol lowering. Lowering LDL cholesterol by 40 mg reduces the relative risk of heart attack by 21% in 5 years, 32% in 12 years, and 52% if it is lifelong. Reducing 20 mg of LDL cholesterol will reduce the risk of heart attack or death by 13%, stroke by 16%, and revascularization by 19% in 5 years in those patients who have already undergone either bypass surgery or angioplasty. A 10 mg lower LDL cholesterol since birth reduces CV events by 16%, whereas a 5 mg lower LDL cholesterol reduces CV events by 7 to 8%. Even 1 mg lifelong lowering of LDL cholesterol results in a 1% reduction in CV events. What does it indicate? It indicates that even modest reduction of LDL cholesterol by mere 10 to 20 mg early in life will have significant impact on CVD risk. Such a reduction can be achieved by lifestyle management, which means heart-healthy diet and regular exercise. Now I will discuss what LAI recommends. According to LAI, everyone should have their lipid profile tested by age 20 or earlier and assess their blood sugar and blood pressure also. This is very important, especially for those who have a strong family history of heart disease and or high cholesterol. A lipid profile assessment does not require a fasting sample. It can be conducted at any time during the day. Everybody should keep their LDL cholesterol within a range recommended by LAI. If LDL cholesterol is more than 160 mg per deciliter, even in the absence of associated risk factors such as diabetes, hypertension, and smoking, a person should contact their doctor as soon as possible and follow their advice. High LDL cholesterol can be controlled by regular exercise and changes in dietary habits in most of the subjects. Some may require LDL cholesterol lowering drugs. By screening for lipid profiles at the time of college admission or the age of 20, we can reduce the number of sudden deaths caused by heart attack among the younger population. I want you, your family members, and your friends to get tested for a lipid profile if not done earlier. In addition, also get investigated for other risk factors for heart attack such as hypertension and diabetes, and follow your physician's advice if required. It is essential to quit smoking and tobacco chewing. Avoid alcohol. In case if you can't, then don't take above the quantity recommended by LAI. You should also discuss with your doctor if there is any underlying disease that could cause lipid abnormalities. If the cause is found, treating it may largely correct the lipid abnormality. You can also spread the word about the importance of lowering LDL cholesterol at an early age to reduce CV events at a later age, which is a significant contribution you can make to the society and to the nation. It is unfortunate that a few persons, including a few doctors, are spreading misconception about cholesterol, that high cholesterol is not bad for our body. This will lead to a tsunami of heart attacks, stroke, if unchecked. You must be surprised that if the above information is correct, then why Mr. X has no coronary artery disease despite very high cholesterol, more than 300 mg per deciliter. Remember, depending on the risk category, significant numbers of individuals will not be fine with this level of cholesterol of more than 300 mg by age 50 years and above. There will be a few lucky persons like Mr. X who may be free from coronary artery disease or may have underlying CAD which has not yet manifested. No one knows who will suffer from heart attack or stroke, or will remain asymptomatic despite having underlying coronary artery disease, or be absolutely free from atherosclerosis. A person's genetic makeup plays a role in atherosclerosis risk along with interplay of other risk factors of coronary artery disease such as obesity, metabolic syndrome, NAFLD, diabetes, hypertension, smoking, tobacco chewing, and even air pollution. Therefore, Mr. X should investigate himself for underlying asymptomatic coronary artery disease by coronary artery calcium score or preferably by CT coronary angiography. He should also take the necessary treatment including lipid-lowering drugs and other guidelines-directed treatment if required. If he does not have any atherosclerosis, he is very fortunate. Remember, others may not be. The information provided in this video has strong scientific evidence. Thank you.